Hi everyone, you are watching the weekly question and answer video that I post every Thursday at 10 p.m. Eastern, and I answer all the sex ed questions that were submitted throughout the week from the Eggplants and Peaches website, www.eggplantsandpeaches.com. And so today I am going to continue with answering all your sex ed questions. We have a lot on the agenda, I think about 16 or 17 questions. So for those of you who don't know, my name is Naomi Lopez and I am the producer of Eggplants and Peaches, a pleasurable sex ed show for teens where we explore sex, pleasure, and everything in between. Let's get started on our first question. Is period sex safe? So I want to answer this in two parts. I want to answer it in regards to STIs, and then I want to answer it in regards to pregnancy. And so let's talk about the risk of STIs when you have period sex. So there are some STIs like HIV, which are bloodborne pathogens, meaning they reside in the blood. And when you're bleeding, you have menstrual blood coming out of your vagina from your uterus, and this is totally normal. But if you were to have HIV, you would be more likely to transmit it to your partner because, there's blood involved. Also, when you're on your period or when you're menstruating, you will find that your cervix will be slightly dilated. And so what that means is there's going to be a little bit more of an opening for pathogens to get into the uterus. And so you could be at high risk of infection if there were an STI present from your partner. You also just need to know that when you're having sex, whether it's with someone with a vagina or with a penis, you need to use a barrier method, so a condom or a dental dam, regardless. So just because you're on your period doesn't mean that you can't use any barrier methods. You need to use condoms or a dental dam regardless. So you are a little bit more of a high risk for STIs if they're a bloodborne pathogen when you're on your period, and you're also more at risk of transmitting it if you have one. The next thing that I want to talk about, which is more of a positive aspect to period sex, is that there's going to be more lubrication. So what that means is you're going to be having sex and there's going to be more lubrication, and that will decrease friction. And if you have friction during sex, that can be really uncomfortable. It can also create microscopic tears in the genitals, and especially for you if you have a vagina. So those microscopic tears are pathways into the body. So if there are STIs present, those are just ways that they can get into your body more. So you're going to want to definitely use lubrication when having sex, but when you're having period sex, you have a little bit more lubrication, so it kind of reduces that risk of microscopic tearing from friction because you have that extra lubrication. So let's talk about the risk to pregnancy when having period sex. So a lot of people don't think that you can get pregnant if you have sex on your period, but that simply isn't true. So if you have sex towards the end of your period, you need to realize that sperm can live for up to 5 days. And what that means is that you can ovulate early, and then the sperm that would have been in your uterus or fallopian tubes from when you last had sex, when you were on your period, could then fertilize an egg. So just be aware that you can still get pregnant when you're on your period, and it is possible. So be aware of that. Okay, next question is, should I be embarrassed that I am loud during sex with my girlfriend? I'm very self-conscious. Well, I can't tell you how you should feel because everyone has a different reaction to what makes them uncomfortable and what's pleasurable for them. But what I do want to say, or what I want to prompt you with, is what about the loud noises makes you uncomfortable and embarrassed? And that's just a really a question to prompt you so that you can self-reflect on why that is. But I'll give you my opinion on sex noises, and maybe that'll help you make a decision on why you're feeling embarrassed and how you can go about navigating through the embarrassment. So from my point of view, sex noises and moans are a really great way to get out of your head and get more into your body. So people are making these noises during sex because it feels good, and because that sense of relaxation and pleasure during sex is also promoting a lot of deep breathing. So if you were to ever go to like a yoga class or you eat something really delicious, you take a deep breath in and then you let it out and go, And so when you're having sex, it's very similar. You're enjoying the sensation around you. And so these loud noises are a result of relaxation and pleasure. And so there's nothing wrong with the loud noises. Also, partners can get turned on when they hear that you are really enjoying sex, and also vice versa. If you're really getting into the sex and you're making these loud noises, it can just feel more pleasure. The one thing that I do want to warn against is that if you think about the noises and you think about your volume, then you're going to be thinking too much, and you're no longer going to be in your body really enjoying the present moment of sex. And so I recommend not to overthink it. Just go with the flow, literally, and relax and enjoy yourself. Now, the one thing I do want to say is you want to be considerate of others. So you have roommates and they're trying to sleep, or they are trying to study for an exam. I would say just be conscientious of the space that you're sharing with people, because you are sharing a space, and so you just want to make sure that people can still focus and can sleep. I've had situations with roommates where I've been up in the middle of the night because I can hear them having sex, and it is frustrating. And I don't want you to hold back, but I also want you to be conscientious of, like, say your roommates are home and they're trying to sleep, or if your parents are home, because that could lead to kind of an awkward situation if they hear you. Regardless, sex noises are positive and they are a sign that you're enjoying yourself, and they can be quite fun. So just let go and kind of reflect on why you are embarrassed and talk to your partner about it, because that could be really sweet and close and intimate for growth. So that's all I have to say about that. The next question is there a right way to masturbate? As I never seem to come, and it's like I'm there, but I never end up coming. And this question was submitted by a male bisex, and they are between the age of 16 to 18, and they are gender fluid. And their pronouns are they and that person. So I don't always give the demographics for everybody, because sometimes it just takes up too much time. But for this one, I wanted to, because I find that sometimes you need a little bit more context when you're hearing my answer. There is no one size fits all for masturbation and pleasure. So it's really just going to take you getting used to what feels good for you. And I know it's frustrating. Trust me, I've been there. I've been there to the point where I felt bad about myself, but I don't want you to feel that way, because it just takes time. Masturbation can be a very tricky thing if you aren't having fun, and if you are putting too much pressure on yourself, it can become really frustrating. So what I can say to start off with is don't make it a thing. Like, don't overthink it or put pressure on yourself to orgasm, because then it no longer becomes fun or pleasurable, and it becomes more goal-oriented and kind of like a chore. So what I can recommend is that you just go with what feels good. So take your time. There's no rush. Go and do it in a nice, quiet space where you're going to have time to really devote to yourself and exploring your pleasure. So whenever something feels really good for you, go with that. Continue to go with that. And don't think about orgasming. Just get lost in the pleasure of it all and stick to it. The next thing you can do is try to focus more on rubbing the head of your penis, because the penis is sensitive in the area that is the head. So the head is going to have the most nerve endings, and so if you focus on rubbing that and stroking that more, then you may find that that's more pleasurable for you. Another thing that you may want to consider would be to use lubrication. So some people will just masturbate without lubrication, and it can be really dry and hot and kind of distracting and not really, pleasurable enough. So if you want to use some type of lubrication, I say go for that, so that it just makes it more pleasurable for you. Now, another thing that's important to mention is that some medications, such as antidepressants and other prescribed meds, can also affect sexual function. So if you're taking any medication, ask your doctor if they could be interfering with your sexual function. That's something to consider, and I wanted to bring it up just to help you kind of figure out what's going on. It could very well just be that you have a mental block and you just haven't broken through it yet, and that's totally okay. I have been there, and it just takes a lot of persistence, patience with yourself, and willingness to continue to try. Next question is, what is fingering? So fingering is a type of sexual activity where you insert your finger into someone's anus or vagina. It can also mean that you would play with someone's vulva, so the outside of the vagina, the part that has the labia and the clitoris, and you could provide sensation by just doing some nice rubbing and stroking and really gentle circles. When you go into the vagina with your fingers, you would want to start with 1 or 2 fingers, just go really slow, whatever feels good for the person that you're doing it to, and you could, move your fingers in and out, or you could stimulate their G-spot, really whatever feels good for them. And just remember to take it slow. It is a type of sexual activity, so you will want to talk about consent and STIs every time. The next question is, what's a blowjob? So a blowjob is a type of sexual activity where someone uses their mouth to stimulate a penis. And so it can be quite deceiving because there's really no blowing involved. It's really more like a suck job. So you are using your mouth to suck on someone's penis to promote pleasure. And you can also lick their anus. And I know that for people your age 13 to 15, this might be really taboo, but it's actually quite normal. So a blowjob can also mean stimulating someone's balls and testicles. And so you could rub your fingers up and down the scrotum, or you could use your mouth to stimulate their penis, and it could be quite pleasurable. But like with any type of sex, you're going to want to have a talk about consent, what's okay, what's not okay. And of course, if someone says to stop midway, you would want to listen to them. Another thing to take into consideration is that with blowjobs, it is oral sex, so you will need to use some type of barrier method to prevent any transmission of STIs, because you can transmit STIs through oral sex. Okay, next question is, what is the most effective way to treat an STI, and why are people shamed for having them? Thank you for asking that. So treatment for STIs is going to vary depending on the type of STI. So STIs can be categorized by 3 different types: bacteria, protozoa, and viruses. Now, bacteria and protozoa, they can be treated by antibiotics, and the type of antibiotics that they're going to be treated with are going to vary depending on the type of STI that they are. And then when it comes to viruses, they are a little bit different. There's a few different ways to treat a virus. You can't use antibiotics on a virus. So some STIs are viruses, and some of them are forever. So you can't cure them. You can only treat them. So for example, HIV is a virus, and it is lifelong. There's not a cure for it. So what people do when they are diagnosed with HIV is that they get treated with antiviral medication, and that will just suppress the virus so that it's undetectable in the body and makes it so that you can live a normal, healthy life. Now, another thing that people do is they can get a vaccine for certain STIs, such as HPV. So the HPV vaccine can be administered to people, and that can prevent people from acquiring one of the many strains of HPV. And another treatment that can be done if someone has symptoms of HPV that can either lead to cervical cancer or, say, genital warts, they can get some type of medical procedure to treat that. So genital warts can many times be removed, and for HPV that's affecting the cervix and causing precancerous cells, they can be taken away through a procedure known as a LEEP procedure, or before then they would be biopsied to see how severe it is, to even assess if you would need that type of procedure at all. Another important thing to mention when it comes to viruses is that your body can clear them on your own. So your immune system is powerful, and depending on the virus, your body can get rid of it by itself. Now, not everyone is able to clear a virus, and you mainly see this with HPV. So most of the time, people will have HPV, one of the many strains, and their body will clear it at a really young age. So that's something that can happen, not always though. Now, to answer your question as to why people are shamed for STIs, it's because society has an issue and they treat sex as really taboo, and so anything that has to deal with sex is going to be held to a higher standard. It can be quite scary for people, and people will claim that STIs are gross or disgusting, and people's language will also, promote shaming, such as, oh, I don't have an STI, I'm clean. So that means that if you have an STI, you're then dirty. So the language that people use promotes the shaming of STIs when there really is no shame, and there is always a risk of STIs when you have sex, even if you are using protection. People that are not promiscuous, that practice safe sex, still get STIs, and they are just part of what comes with sex. And some people don't get them, and a lot of people do get them. So it's just important to make sure that we destigmatize sex, and with that we'll come the uncoupling of stigmatizing and shaming people for getting STIs. The next question is, do you have to shave pubic hair or not? The straight up answer is no. You can do whatever you want to do with your pubic hair. Pubic hair is actually there so that it can protect your genitals. The reason that it's there is so that pathogens don't enter the mucous membranes of your genitals, and so it's actually there for a reason. So technically it would be considered unnatural to remove the hair. Now, some people remove their hair because they like the way it looks. It's more comfortable. So some people like me have really coarse hair, and when it grows to a certain extent, it can become really itchy and uncomfortable. So that's a reason why you might want to remove it. And it all comes down to personal preference. But what I can say is, don't let anyone pressure you into removing your hair unless you want to. You can experiment with removing it, you can experiment with growing it out, but do what makes you feel most comfortable, and don't fall into the pattern of doing it because someone's making you or because you want to earn someone's love by removing your pubic hair. It's just not right, and you should really do what you want to do with it. You can shave it, you can wax it, you can leave it alone, you can trim it. It's all up to you. So pubic hair is yours. Embrace it if you want to, shave it off if you want to, but it's there for you to do what you will, and just know that there is a reason why we have it. It is there for protection. The next question is, what is the best way to deal with my period during school? Well, what I say is always have your period products with you, even if you're not on your period. So, for example, have a special place for your tampons, your pads. If you have a menstrual cup or reusable pads, always keep a little stash in your backpack or in your locker so that if you start your period early or if you're spotting, that you can just use it and grab those products when you need them, and there won't be any worrying about it. The next thing you're going to want to do is change your period product, whether it's a tampon or pad, sooner than you think. So give yourself time, and this may look like less socializing between classes, or letting your teacher or instructor know ahead of time, hi, here are my things, they're in the classroom, I need to use the restroom, I might be a few minutes late, but I just want to let you know. That clear communication can really go a long way. So if you need a little bit more time to use the bathroom to make sure that you feel safe and clean and guarded against any leaks, that you have the time to do that. Now, what I will say is you want to make sure that you are changing your period product earlier than you think. And the reason I say this is because I remember being in school, sitting for a long lecture, whether it's even an hour or less, and then I stand up and then all of a sudden there's a gush of blood and I'm like, oh, shoot. I gotta get to the bathroom. And so if my pad was already almost saturated with blood and I stood up and it was just gushing, I was surely going to leak. So what I can recommend for you is to change it before it's almost full, so that if it does gush when you stand up, that you're safe and that you're protected against any leaks. And if you do leak, it's not the end of the world. It totally happens. It's just the way it is. But you can also have an extra pair of pants and underwear in your locker or backpack so that you can change and feel good about yourself if you happen to leak. But it is totally normal and it does happen. So if it does, just know that you're now in the club of the people who have leaked their pants in public. And the next question is it okay to wear a short dress while I'm on my period? Now, that's totally up to you, your comfort level, and the flow of your period. I wouldn't recommend it if you have a really heavy flow and you're not going to have many chances to change your period product, just because then you could leak and it could run down your leg and become quite messy. So what I would recommend is having your period products with you, making sure you have enough of them, and changing your product often. And you can also wear a panty liner so that if you do start to leak, you feel it before it gets your panties soaked with blood. But there is no difference in if you're wearing pants or if you're wearing a dress. It's just the fact that if you leak, it'll probably leak down your leg rather than getting absorbed by your pant or your pantyhose. So it's totally up to you. You can wear a short dress, but if you have a really heavy flow and you're not going to have a chance to change your product, you might reconsider it, just because it could make you uncomfortable. It could distract you from doing whatever it is you're doing. The next question is, does sperm stain underwear? And to answer your question, no, it doesn't stain, but when it does dry, it becomes white and crusty. But if you use soap and water, it will wash away. The next question is, what does it mean when a girl gets wet? So, vaginas get wet for multiple reasons. The one reason that comes to mind is that vaginas are self-cleaning, meaning you don't need to put soaps in your vagina. You don't need to do anything. It's really amazing. They clean themselves. And what that looks like is there's going to be fluids that come out of vaginas throughout the day. And so if you're watching this and you have a vagina, you already know that throughout the day, and depending on which day of your menstrual cycle you're on, you may have more discharge than other days. And so your underwear may get wet, or they may become wet and then crusty depending on how much you have and when it's dried. So that's totally normal. So vaginas can get wet because they're self-cleaning, and this is healthy. It's how old cells get removed from the vaginal walls. It's how the cervix releases fluids, and it's also a way that it keeps everything lubricated and the pH remains normal. So it's a way that the vagina regulates itself. Another reason could be because the vagina, or the person that has the vagina, is aroused. And so arousal fluids will be produced, and that is a type of lubrication. So it can be a few things, but those are the two main reasons why a vagina would get wet. The next question is, how do you know when you've had an orgasm? Well, there could be physical signs such as you ejaculate. So there's some type of fluid that is coming out when you reach climax. Or it could be, and what I think is most obvious is there is like a buildup in your body. You are feeling an immense amount of pleasure. There's this big buildup, and then all of a sudden you've reached this peak, and it's like this release of pleasure. And then when you're done with the orgasm, you just kind of come back down. So it's like you build up, 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 up. You reach the orgasm at the apex, and then it's like a relaxation roller coaster of endorphins and a really great relaxing feeling. Some other signs of an orgasm could be your leg is shaking, your pupils could dilate, and you just get lost in the sensation of pleasure. I hope that answers your question. It's a little bit amorphous. So what I can say is, you know when you've had an orgasm. You just know. The next question is, does oral sex count as sex? Now, I think it does count as sex, and it's not full-on penetration, but I do think it does because it involves, first of all, an exchange of body fluids, which could put you at risk for STIs. It requires a conversation around consent. People's emotions can get involved. It can result in a lot of pleasure and a release of oxytocin, which people call the love hormone, but it's really great for producing relaxation, a feeling of connection and euphoria. So all of these things considered, yes, it may not be penetration, but these factors all are, all of these factors are things that make up sex. So yes, I would consider oral sex sex. Next question is, how do you get someone to like you? Well, there's no set of rules on how to get somebody to like you, but what I can say is, and this sounds cliche, but you want to be yourself. You want to make sure that somebody likes you for you. So if you're pretending to be somebody else, then it's not really going to work out. So you want to be confident. You want to know who you are, and you want to approach that person with kindness and sincerity in your kindness. So you want to, first of all, consider developing a friendship with them and, being kind to them, getting to know them genuinely. There should be no ulterior motives. You shouldn't be getting to know them just to have sex with them. If you really like someone and you want them to like you back, then be nice to them, be kind to them, show them that you care, and become a trusting and safe person for them. If they ask you for space, give them that space and respect their boundaries. That's going to be huge. I think giving people the space that they need is a huge sign of respect. So you want to be yourself, you want to be their friend, and you also want to give them space when they ask for it. You can just say, hey, do you have time for a conversation? And you can sit them down and you can talk with them and say, I like you, and these are the reasons why I like you. I'm just wondering if you like me back. And if they say no, you need to respect that and don't keep trying. Just accept that they don't like you. It happens, and I'm sorry, but you can't just keep pushing someone's buttons and hoping that they will accept you and like you, because that can be breaching consent. So respect that. If you are rejected, it's okay. Somebody will like you. And the person that you liked and that didn't like you back just wasn't the person for you. The next question is sex messy? And to answer your question, it can be. When you're having sex, you have an exchange of body fluids. So this can be saliva, it can be arousal fluids, ejaculant, sweat, because you have two bodies and all that body heat can make the room and yourself very hot. And then also sometimes blood if somebody's menstruating or if there's some type of tear. So with that in mind, all of these fluids could create a mess. So it can be messy, but it's not always messy. The next question is, I understand it may be different to the social norm. However, how can I go about getting people to understand my they, them pronouns? This person identifies as gender neutral and their pronouns are they, them, and their sex was other. So I want to just say that I'm glad you're asking me, and I'm going to give you a short and concise thing to tell people. But it's also not your job to be the educator of they, them pronouns and non-binary identities, because that can be very exhausting, and it's not your job to educate the world. You know, people have access to Google and the internet for the majority, for the most part. So they can do their own homework, and I trust that people can learn if they truly want to, and I don't want you to get depleted because you have to tell everybody and teach everybody about your pronouns, unless you want to. But if at some point you're getting tired of it, I want to give you permission to take care of yourself and take a step back and know that it's not your job. To lay the foundation, sex is something that people are born with. It is determined by a combination of XY chromosomes, and it's a foundation. And then on top of sex, you have the gender construct, which is not actually real. It's a amorphous set of rules set by society that tell people how they should act based on their sex. However, sex and gender do not always align. And when you think about it, gender is a spectrum. So you have females on one side of the binary and then males on the other side of the binary. And everything in between is completely valid to identify with. And they, them pronouns reside somewhere in the spectrum depending on how you identify of gender, which means that you are expressing yourself in a way that does not match up with the way that people expect you to based on your sex. And as the more people become used to they as pronouns, the easier it will be for them to digest. Before I meet somebody and before I introduce myself or before I get to know somebody and assume their pronouns, I always refer to them as they, because you truly do not know somebody's pronouns just by looking at them. And I've learned this from working with transgender patients at a gynecology clinic. You just do not know who is transgender or non-binary. So you always refer to somebody as they or their name before you assume their pronouns. And so they, when you don't use it often, and for many people, is going to sound like a plural term. So people think they is a group of people. But the more you start using they and the more people start hearing they start to understand that they does not mean plural. They can mean plural and it can be singular. So rule of thumb, gender and sex are not the same thing. Gender is a spectrum, and either end of the spectrum is male or female, and they pronouns fall somewhere along the spectrum. I hope that makes sense. If you want to send me a follow-up question on that and you want to talk to me more, go ahead and copy and paste the question and just say, hey, this is a follow-up to the question that I submitted, and I would be happy to speak to you more on that, because I think it's really important that people understand that sex and gender are not the same thing. You need to ask people their pronouns every single time. It's not an option, and they is a default before you know somebody's pronouns, because you cannot tell what someone's pronouns are just by looking at them. So the next question is how does sex feel? And this is a really difficult question. I'd say it's probably the most difficult question that I've gotten all week, just because it feels so different on depending on a variety of factors. And so emotionally, it can feel very different, and physically, it can feel very different. And so I'm going to give you some examples of both, and then I want to talk about how it can feel for people who are just starting to have sex in your age bracket, so 13 to 15, and also people who are just starting to have sex in general. Sex can feel different depending on the type of sex you're having. So the mood of sex, so we're going to call it the flavor of sex, will be different depending on the type of sex you're having. So is it really slow, snuggly sex, and is it just really soft and gentle? Well, then that's going to feel different than if you're having really passionate, fiery sex, right? They're just different. It's like you can consider sex to have different emotions and moods to it. So it's going to change depending on the mood that is set for that type of sex. Now, physically, it can feel very relaxing, very pleasurable, and this generally happens if it's with someone that you trust and there's consent involved, and it's overall very positive if these things are present. If that's not present, if somebody is using coercion, if there's not consent involved, it can be very uncomfortable, and it can be overall negative. So sex is very powerful, and that's why I say people need to know what they're getting into before they do it. And for people that are just starting to have sex, if you have a penis, it can be so stimulating at first that you might ejaculate before you even get your condom on, before you even get started. This is normal. Do not make fun of people who prematurely ejaculate. It just happens, and it's because it's very exciting. The visuals of sex, you're seeing somebody naked, you know that you have consent, you're going to go deeper with them. It can be very exciting, and that can lead people with penises to ejaculate very quickly at first, and that's okay. And generally, the more you do it, the more you can, hold it back and go for a little bit longer. But at first, it can be very overwhelming, and that is normal. Now, for people with vaginas, I want to just say, take it slow and be patient with yourself, because sex can be uncomfortable and somewhat painful in the beginning. So lubrication and foreplay is going to be huge, making sure that you feel safe with the person you're doing it with and going really slow. Now, the tissue in the vagina is elastic, but it will need to stretch. And so the first few times that you do it, those tissues will need to stretch, and so that can feel a little tight, a little hot, and a little bit like a burning sensation. So just use lots of lubrication and take it easy and say stop if it's too much and try again later. Now, orgasming can be somewhat more of a process for people with vaginas, so just be patient with that. Take your time and make sure that you don't overthink it. And sex will become more natural as you do it. But just make sure that you're actually ready to have sex when you do it, and you're doing it with somebody that you care about and somebody who respects you. Make sure you're talking about consent, use protection, and talk about birth control if you have a risk of pregnancy with it. Alright, everyone. So this concludes the December 17th segment of Eggplants and Peaches question and answer. And if you would like to participate, please send your questions to eggplantsandpeaches.com. I will get to them throughout the week and record a video and upload it to YouTube every Thursday at 10 p.m. Eastern. Thank you so much for watching. I'm your host, Naomi Lopez, and that's a wrap.